Hello, I'm Dr. Inman. This is a miniature lecture on acute pain or pain in the canine, feline, and equine. Pain is a phenomenon that the body uses to remind the body that there is an injury or a site that needs attention, essentially. A lot of times the pain can be so severe that the body will avoid that area, which brings about all kinds of problems, particularly in the equine, because the equine basically's feet, for instance, it could be injured and produce pain so far away from the body, essentially, that they get isolated and the blood supply shuts down and the body won't heal well. A lot of times with VOM and also with the laser therapy will actually remind the body that that tissue is down there and needs to be taken care of. So pain is not necessarily a bad thing. However, it can be something that's incapacitating, essentially. And when we utilize the VOM technology, we're not only opening up neurological channels, but we're also closing down the pain gate. Now, it would take me too long to explain to you what the pain gate is. We go over it extensively in Module 1, and also in the mini lecture series that's free on the vomtech.com website. In other words, we explain to you exactly how the silly little whacker device makes the pain go away and also induces the animal to heal. It's imperative that you understand that, but pain and discomfort essentially is something that is concomitant with lots of different injuries and diseases, either acute or chronic injury essentially. Back pain is a classic example of something that we will do. When we go through with an animal with back pain or a person with back pain, we can basically cut down or shut off the pain gate essentially and allow the body to investigate, handle, and address itself to heal that particular problem, which is one of the main reasons that this device and this technology, the VOM technology, works over a long period of time. The other thing that we can do too is we can utilize laser therapy to address pain directly. There are a number of frequencies that we can use on a painful area essentially effectively. The 425 frequency, the 25 frequency, and the 666 frequency, which we use in human beings a lot, can be very effective in reducing pain. Now, I've mentioned this about pain control, for instance. If, for instance, you were in pain and or your spouse was in pain for an acute injury of some variety, we would go ahead then for about 120 to 180 seconds, go ahead and laser with those particular frequencies, particularly 425, 25, and 666, and then your beloved spouse or your patient would say, well, look, I'm not any better after 2 minutes of lasering. And that's probably true. However, what happens is we open up, we shut down the pain chemical in the actual tissue, the arachidonic acid cycle, and we also increase the blood supply to dilute the pain chemical in the tissue to the point where the pain will drop away. However, it takes anywhere from a half hour to 45 minutes before the client, human being in this case, would actually perceive that their pain went from a 7 or an 8 down to a 3 or a 4, for instance. So people aren't cognizant of the fact over a period of half hour, 45 minutes, that their pain is diminishing. It just goes down slowly and they're feeling more normal. Unless you actually ask them about 45 minutes later, you were a 7 or an 8, now what are you? And they'll go like, oh, well, I guess I'm feeling better. It must have been the aspirin I took, or something like that. But the point is this is an effective way for us to diminish the pain control. Now, class 4 lasers will also cook the tissue, producing nitric oxide, which has the ability to cause vasodilatation, and it will, in fact, dilute the pain chemical. But what we're trying to do with a frequency-specific laser is we're trying to reverse the effects of the arachidonic acid pain cycle, and also open up the blood supply effectively and completely over a period of time and induce healing. So we treat acute and chronic pain with adjusting technologies and the laser therapy essentially. This has been a short lecture on the acute pain in the dog, cat, and the horse, and also the human essentially, and I would have you go to the vomtech.com website and look at that particular tissue. We'll explain in detail in the 3 free videos that are on the index page of that website exactly why it works essentially, and show you how to do it and do it in your practice. Thank you for listening and have a great day.